Hello, my name is Christina and I'm an occupational therapist, and I'm talking to you guys today about kitchen modification for arthritis. So this could be for rheumatoid or for osteoarthritis, which is just a breakdown of the joints that causes pain in your hands. And then the rheumatoid is the autoinflammatory disease. If you're watching this, you already know that, but there's periods of flare-up, usually more involved in the mornings, and so you really want to take it easy on those joints, and they'll kind of make you because they're going to hurt. And so for my older generation patients or my hardworking patients who just push through the pain, don't. When it's rheumatoid arthritis, don't push through the pain. Allow your body to rest, because what happens is that with that increase in fluid in the area of your joints, especially small joints, you are placing yourself at risk for joint deformities. So those there are no muscles in the ends of your fingertips. It's all tendons, and they can slip out of place, and then that's why we see people end up with what we call owner drift, where their bones begin to take this shape and they get stuck in these positions. Wrists can become unstable, and so you want to, during those periods of flare-up, you want to rest. And so, but you still need to cook. You still need to function in your home, and that's what I'm addressing today. So I'm just making some sweet potatoes, and I just do this as preventative care for my body. So you can have somebody else kind of chop a big piece of a sweet potato for you, or a regular potato, or whatever you're doing, okay? And then just throw those in your blender. You don't have to have a fancy chopper. Just put them in your blender. And whenever you turn that on, what you're going to get is, do you see these tiny little pieces of sweet potato here? Okay. That's what I've got in here. That's what this is. And I'm still going to be able to eat it, enjoy it, and I'm still going to be able to cook it. They also make like slicers where you can just kind of slide across it. I recommend getting one of those, and you can get different shapes of your vegetables like this. So that's another way to modify. And then think about whenever you're purchasing, make smart purchases, like go ahead and get the shredded carrots or get the chopped carrots, instead of having to buy something that you're going to have to cut up. So you're worth it. Spend an extra $1 on yourself. What about broccoli? So cutting up broccoli, because to an able-bodied person, it doesn't seem bad, but somebody with arthritis in the small joints of their hands, it hurts to chop that up or even to pull it apart. So go to Walmart, spend $4, and get a bag of already chopped broccoli. Good modification, right? When it comes to onions, it's hard sometimes, and I'm going to use green onions for an example. It's hard sometimes to grip something small like this, because look at how much more your hand has to close to be able to do this. But if you can get yourself a pair of, where are my kitchen shears? Look at this. Okay, I like this better because I can go through and I can just chop. This is a much easier motion to do this than it is to have to close my hands the entire time to hold a knife to chop. So get you some kitchen shears. Those are actually a good modification because they're like a chopping knife, and I really like that. So your 3 things today are blender, chopping knife, purchase already cut vegetables, and then I'm going to add another one. Get yourself an electric can opener. And then they make something, there's a brand called Dysum. It's like a hand grippy mat to open jars. So get some kind of grippy mat. They sometimes I've seen it at little therapy fairs or job fairs. They'll have like a little hand mat. It just has extra grip, so you can just kind of put that on your can and open it. It's like a little sheet of paper that you would stick on top of here, and then you just twist. Bringing me to my next and final point, I want you to use your big joints, okay? So how can I use my big joints versus my small joints, because my small joints are more at risk for breakdown than a larger joint is. So whenever I go to open this, instead of having to use my finger, look how much my fingers are bending. Instead of having to do that, how can I put my palm on this and use my hand to open it? Now, I'm not going to open this because it's sealed and I don't want to, but you can with a grippy mat, and then using your palm, you're going to put pressure down, push the pressure down, and then give it a turn as you're using this other hand to stabilize. So I'm using my palms, my big joints, instead of using my fingers to grip and do this, because then, remember, they're at risk for, that's why they start to deviate like this and they get stuck like that. So you want to think ahead and take care of your body. Joint protection technique, big joints, not small joints, and think about how you can apply that to your life. Thanks.